how does a state's decision on expanding Medicaid impact an employer's choices?
Okay. So as you can tell from what I just said, in my mind, the exchanges created by the Affordable Care Act really are largely aimed at the lower income, all right? So just to kind of do a real quick look back to show you something that I often find people haven't realized it goes on. When the Affordable Care Act was originally passed, the initial idea was that, as you remember, they said basically everyone below 138% of federal poverty level, you make less than $15,500 a year, Medicaid, period, across the country, no matter, you know, you're Medicaid eligible, you go into Medicaid. That was what they had assumed they were doing in the law. They were hoping they were not going to impact employer-sponsored insurance, which of course they did, but that was their hope. The idea was that basically, if you were making over that, you were employed, probably full-time or hopefully full-time, and your employer was offering you insurance and they just wanted that to continue. But they figured sitting in the middle were a lot of people who weren't getting employer-sponsored insurance because they were part-time largely or, you know, working with a small employer, and they needed a way to purchase and for it to be affordable. And so they created exchanges. More importantly, they created the subsidies. The Supreme Court got involved and changed that, all right? But why that matters is this. When the Supreme Court changed it, there was an odd little line that was written into the law that had just been thrown in that says you're only eligible for these exchange subsidies, right, if you are not offered affordable insurance by your employer of minimum value and you sit between 100 and 400% of federal poverty level. But wait, why is it 100, not 138? Because they assumed, it also says, by your employer, offered insurance by your employer, or on a government program, government health program. They assumed everybody under 138 would be on a government health program, except a very small group of legal immigrants that weren't covered. So they put the 100% in there, thinking it didn't matter. What does it mean? It means that in every state that doesn't expand Medicaid, people starting at 100% of federal poverty level go into the exchange. Bottom line of that is, in every state, there is an expansion of coverage. People now at 100 are in an exchange. So what did this lead to? In states that didn't want to expand Medicaid, or even if they did, they said to the federal government, well, can we do this? Can we put all those people between 100 and 138 into the exchange and just expand Medicaid up to 100? The federal government said, no, you can't do that. So we actually, it's rather interesting, it's a huge number of people, 3.5 million, that are sitting in that little bucket that are in an exchange but sit in this little Medicaid category, all right? I'm going into this too much, but I want you to understand something. This new category at the top of this, the 100 to 133%, look how low that is. This is $11,490 a year. You know, this is an extremely low income level. So in the states not expanding Medicaid, you now are selling policies in exchanges to people at this income level. They'll obviously drive down as low as they can in terms of the monthly premium, but they do have a little bit of skin in the game here, and they're clearly going to have co-pays and they're going to have other costs that are out there. But this population, 40% of them are unbanked. They don't even have bank accounts. This becomes a very complex process, and it's not a population that many of the commercial carriers are used to chasing. So you're seeing a lot of carriers going into these exchanges and looking to go into the exchanges who are also in Medicaid, right? So the bottom line is, going through a very long-winded explanation of this, John, we sit right now with about half of the country with people that are actually at poverty level in exchanges. It completely changes what these exchanges look like and the populations that are in them. And it's also where you will see in the next few years some sort of a deal being cut to have the states that right now haven't expanded Medicaid. Come January, everybody over 100% in those states that didn't expand will be eligible for insurance. Those states are not going to expand, take them out of it. So there'll be a deal cut where they stay in the exchanges, but they now become subsidized through the Medicaid program. The two programs are going to continue to evolve together, making public exchanges more and more an extension of Medicaid and more aimed towards low income. That was my long explanation to get there.
It was very clear. Thank you.